What are you waiting for?
Japago, South Africa has had a privilege to collaborate with the Department of Health and to launch a voluntary medical male circumcision program in a district called Nkangala. And on the 29th of June, we met with hundreds of people at Tembisile municipality to actually launch this program. And specifically, what is exciting about this Japago and Department of Health program is that it's a collaboration between the Department of Health and Japago in providing high quality and high volume MMC services to men who actually are eligible for the program between 15 and 49 years, but we can always do those who are younger.
The launch that we are having today at KwaMhlanga Hospital has got to do with the voluntary medical male circumcision, which has been the presidential call, which has been the minister's call, that we get males circumcised in order to reduce the HIV/AIDS infection. Today we are doing it for the first time in this community of Tembisile at KwaMhlanga Hospital in conjunction with the mayor, the community, the traditional leaders and all the other stakeholders, so that we make this a success and reduce the rate of HIV/AIDS infection.
We offer a package as mandated by the government of South Africa. The client is being counseled and then they're being screened for any other conditions, whether it's sexually transmitted diseases, chronic diseases, TB, and then they have the choice whether they want traditional or medical male circumcision.
So the program is more than just medical screening, the health screening, initiate before blood pressure, STI, before harm.
The minister saw that it will be wise if we form partnership with the Japago and the FPD Foundation Professional Development to come on board in partnership with the Department of Health to come and help to fight this pandemic. Volume testing is at least a minimum of 40 people, not maximum, minimum of 40 people per day. So we are hoping that with the mobilization that has been done by our traditional health people, by our own mobilizing committees, they will be able to get as much people as we can so that we can be able to give the service to the people. We can try to alleviate that using the medical way of doing things, but respecting the culture and the heritage of the people.
Japago has been operating over the past 35 years in about 120 countries. Japago's focus areas is family planning, sexual and reproductive health, HIV/AIDS, maternal newborn child health, and then also infectious diseases. We have technical leaders in all the countries we're working in education, training and healthcare services. In Japago, we say that, where there's a will, there's a way. And for us in Japago, there's only one way, and that's saving lives. And I must say, Japago is a great organization to work for. Japago has been operating in South Africa since 1995. The local entity has been registered in 2007. And we're very fortunate as a local Japago South Africa to be affiliated to Japago Corporation, because we can really pull from the global expertise, the regional expertise, and of course we also use other resources, especially financial resources. The medical male circumcision program we just initiated in South Africa is obviously a response to the huge HIV epidemic in this country. The HIV prevalence is for males in the country is 18.8%. 12%, if not more, of the population is affected by HIV. And we have a country where we have up to 5.7 million people living with HIV and AIDS. And this is very scary statistics, and the epidemic is being fueled by multiple concurrent sexual partners. And of course, we have a very low MC or male circumcision rate of about 45% in the country. So our program is a direct response to that. Various studies have been done, controlled studies over the past years, including one that we've done at Orange Farm in South Africa, and it has shown that female to male HIV transmission can be reduced by medical male circumcision by up to 60%. The 60% reduction of HIV through a simple procedure like medical male circumcision, it's, I think, great for us as a HIV prevention program because it's easy, it can be done in any health facility setting, and the client can go home immediately after the procedure. The 2009 statistical model based on the HIV statistics in South Africa suggested that if we reach 80% of eligible men in South Africa, we can avert up to 1.2 million infections. Based on all the evidence and the studies being conducted, the WHO also came up with a minimum package that we need to use, including counseling, looking at age-appropriate counseling, HIV/AIDS, your STI counseling, and to provide a comprehensive care. And I think that linked directly to our national strategic plan.
Lingathatha sinqumo sekuthi lisekhamsize noma lisekhamsize madvodza ngebuningi. Kukhona lokuhle lokuvelako ekutheni emathuba ekusuleleka ngaleli gciwane ayancipha nga up to 60%. Kwendiwe ke lokho eKenya, kwendiwa eUganda, kwaphinde kwendiwa futhi nala ekhaya South Africa.
We're not only working with Department of Health, but we have collaborated with the traditional circumcising communities to bring about a link or collaboration in provision of safe and quality medical male circumcision programs, and that's actually one of the strategies we will be using ongoing. And we're very excited on the launch that we got quite a lot of support from that wing of the community. And we also are collaborating very closely with traditional health practitioners who are really a very important source of medical, or should I say care or health care, for almost like 60 to 80% of South Africans. They do see quite a lot of men, women and children who come for consultation to a traditional healer.
To the community, the people are not the same. There are those, especially those in a culturally, they think that if this program is inside this hospital, they're going to lose their clients. You understand that when we are undergoing this of a culturally, people sometimes they pay, but here is free of charge. So they are afraid that the people, all of them, they'll come here. So to the society, there are those who are happy and those who are not happy. Traditional health practitioners and the health department, we are working hand in hand. So the health department, they've got all the resource for counseling, testing. So in the mountain, we know there's no such. So that's why we support this program.
We also hope to work with organizations or companies that actually recruit a lot of men. So you're looking at unions that work with miners and agricultural workers to bring about this program to them as well. And because JPIGO does not work alone, we believe in partnership. We actually have brought together a variety of stakeholders, other NGOs, such as Soul City and JHISA, and we have also brought in other NGOs such as Africa Health Placement, who are actually helping us with healthcare workers, and also collaboration with Department of Health.
Our role in this MMC program is to encourage people to come and circumcise. At the beginning of the year, we had a Soul City series with one of the themes as medical male circumcision. And this was on TV for 13 weeks. And thereafter, we've also held dialogues in communities throughout the country, talking to people about it. And we've trained people how to run dialogues, talking to people about medical male circumcision. And this is done with a number of organizations like JPIGO. We work very closely with organizations that do the circumcisions themselves, like JPIGO. We work as their communication partner. We've also developed booklets which we'll be distributing throughout the day, and we also have radio talks. Today we'll have Ikwekwezi doing interviews with a number of people and even encouraging people to come here.
nomphakathi ubuza imibuzo ngehlelo leli lethu namhlanje
ukuthi abantu bakhethu bangayilisa izinto ezidinga laba bamhlophe bese vele sifuna ukuthi mina ibe engomeni angiyazi.
Well, today I hope to see people coming in to circumcise, because as we've been told by medical people, this is the period where it's easier to heal and it's not as painful. And we've heard when we talk to community members that there is an understanding from people that they know that it's a cooler period and they can do it. It's easier to do it around winter.
We're very excited to have been able to launch this program despite the challenges and the unique situation that we've found ourselves in KwaMhlanga. And this is just to say thank you for all the partners who have made it possible for us to be able to say we have a program running and contributing, more importantly, to South Africa's strategy for preventing HIV and AIDS. And as you know, we do have a national strategic action plan for HIV and STIs from 2012 to 2016, and a huge target set for South Africa. And it is a privilege for JAPIGO to be contributing in partnership with the Department of Health to reaching the targets of men who are circumcised for HIV prevention. If I look into this day or the program that has already started or kicked off in KwaMhlanga, Tembisile specifically, is the enthusiasm and the excitement and commitment that the Department of Health has actually embraced this program and made it their own. But also, most importantly, the fact that the communities came blazing. And they really were very excited, though we got a lot of areas where we still need to improve on. And what I liked most on that day was the fact that you got communities actually expressing their views and giving also their commitments, how they are excited to have this program, and they all came in numbers. And they all supported the initiative, the launch of that program, but more importantly, we also actually had their views where they had felt needs that they felt the program was not quite addressing, or the program was kind of a threat to some of their cultural practices. It was a great opportunity to discuss with community members and see how we could take this program forward.
Ngoba nikhuluma into le nikhuluma hlangana namadebele thina abantu abawelawo ukwela sikudlala bamasombo kungudokodere unenranga naso uthatha umntwana abantu umusa kule ndlela le kuthi ukuthi isikhethu siyasigadanga siyasilala.
Uhlukephi ukusoka kwengomeni nesibhedlela na? Labo abasoka esibhedlela bazinranga bani ngokuthi ukusoka sazi kunenranga.
Manje namhlanje sini nasenithatha into leya yamandebele leya plus niveza lalapha kungakafaneke kunabantwana abancane la.
Akusilo kwehlelo ngicela ngingalele kahle, akusihlelo lelethwe ngoba lifuna ukuphazamisa noma ukuphikisana noma ukukhompyutha naletinye inhlelo levele startiwe ukuthi ithi imihambo yethu amadoda awayo ibhedlela nasemakliniki. Yingakho ke uma sithatha the conscious decision yoku-implementa le program, bekunama consultation ngale program ingaka-implementwa. Ayikho inkosi engajatshulisa ukuthi mhlambe ikhona, mhlambe ingoma iyachubeka kodwa abantu bayena babuya kuthi wesebabulawa ile HIV. Uma ngabe kuna any initiative ugovernment anayo ukuzama ukuprotecta abantu ukuthi baphile isikhathi eside, amakhosi bayakusupporta lokho. Asifuni iculture yethu iundermine abantu abashonayo ngoba mhlambe kunezibagula.
I must commend the Department of Health, KwaMhlanga Hospital specifically, for the commitment that they've given to the program, and they've made it their own. And I think as JAPIGO, we're very excited to be in that partnership.
What are you waiting for? It's cool, it's clean. It protects, it saves lives. Let's say